Hi, I'm Dr. Sarah Collins, and today I want to talk directly to anyone over 40, 50, or 60 who's noticed their legs feel cold, tingly, or painful when walking, or if you've struggled with wounds that just won't heal. You may not realize it yet, but poor leg circulation affects millions of older Americans, quietly putting you at risk for blood clots, heart attack, stroke, and in severe cases, amputation. I've treated thousands of patients over my career, and what most people don't know is that declining circulation is not an unavoidable part of aging. There are scientifically proven ways to dramatically improve blood flow in your legs, and it starts with understanding the right vitamins your body may be lacking. If you've ever assumed that feeling numbness, tingling, or cramps is just getting older, I want you to pause and hear this, because the solution is far more powerful and simple than you might think. Poor circulation in the legs isn't just uncomfortable. It can show up as cold feet, cramps, numbness, tingling, or wounds that won't heal. And these are warning signs your body is struggling to get oxygen-rich blood to your tissues. Most seniors assume medications are the answer, but traditional prescriptions like Silostool or Pentoxify often provide modest benefits at best and come with side effects. Supplements like magnesium, which many people think help circulation, have been proven by multiple studies to do very little for actual blood flow. But here's the key. Specific vitamins, taken the right way, can restore leg circulation, sometimes within days, and prevent complications that most people accept as inevitable. Through my work as a vascular specialist, I've learned that nutritional strategies can often be more effective than surgery or medications for older adults. Many of my patients came to me after multiple unsuccessful interventions like bypass surgery or angioplasty, facing severe leg pain or ulcers that wouldn't heal. Once we identified their specific vitamin deficiencies and addressed them with high-dose, targeted supplementation, we saw incredible results. Wounds that had stayed open for months began to close within weeks, walking distance doubled or even tripled, and amputations were avoided. Yet most adults over 60 have these vitamin deficiencies, and the majority are never tested or treated. Studies show that 40 to 60% of seniors have deficiencies in key vitamins that support vascular health, and in patients with peripheral artery disease or diabetes, deficiency rates exceed 80%. These deficiencies happen for several reasons. Older adults often eat less due to poor appetite, restrictive diets, or chronic illness. Age-related changes in digestion, like reduced stomach acid, impair nutrient absorption, and medications like proton pump inhibitors or metformin can deplete essential vitamins. Chronic diseases can increase the body's requirements for certain nutrients, and interactions between medications can further reduce available vitamins. When these deficiencies occur, circulation suffers, and the symptoms can escalate quietly over time until a serious complication occurs. There are two main reasons seniors develop poor leg circulation. One is peripheral artery disease, which affects millions of Americans and happens when arteries supplying the legs narrow from plaque buildup. This reduces blood flow, causing pain while walking, cold feet, numbness, tingling, slow healing wounds, hair loss on the legs, and in severe cases, tissue death requiring amputation. The second is chronic venous insufficiency, which occurs when damaged vein valves prevent blood from returning efficiently to the heart. This causes swelling, heaviness, skin changes, and sometimes painful venous ulcers. Both conditions worsen with age and share risk factors like high blood pressure, diabetes, smoking, obesity, and high cholesterol. Both can lead to devastating complications, including non-healing wounds, infections, blood clots, and in extreme cases, leg amputation. Every year, in the United States alone, around 150,000 to 200,000 leg amputations are performed due to peripheral artery disease, and the vast majority of those are in adults over 60. But here's the incredible part. Multiple high-quality studies published in Circulation, the Journal of the American College of Cardiology, the European Heart Journal, and Vascular Medicine show that specific vitamins improve leg circulation in real, measurable ways. These vitamins work through well-understood mechanisms, improving blood vessel function, reducing inflammation, enhancing red blood cell flexibility, promoting the growth of new blood vessels, and supporting the structural integrity of your veins and arteries. These benefits aren't hypothetical. Randomized controlled trials show that vitamin supplementation can improve ankle brachial index measurements, tissue oxygenation, walking distance, wound healing, and even amputation-free survival. The most important discovery is that different vitamins work in different ways, and knowing which deficiency you have is key. Randomly taking vitamins without guidance may waste your money and time. Targeted supplementation based on testing produces dramatic results, even in patients who had previously tried medications or surgery with minimal improvement. In this video, we will discuss 6 vitamins proven to improve leg circulation in adults over 60. Each works in a unique way to protect your blood vessels, enhance blood flow, and prevent serious complications. I'll cover how each vitamin functions, how deficiencies develop, and how supplementation can transform leg health. By the end, you'll know which vitamins to check for and how to use them safely and effectively to reclaim mobility, prevent wounds, and dramatically improve circulation. We'll start with the 6th vitamin, vitamin E, which protects the endothelium, the inner lining of blood vessels, from oxidative damage. It also increases red blood cell flexibility, allowing them to squeeze through tiny capillaries more efficiently. Vitamin E reduces platelet aggregation, lowering the risk of clots, and decreases inflammation in vessel walls. It's a critical antioxidant that keeps blood vessels healthy, and studies show supplementation improves blood flow, tissue oxygenation, and even healing rates in diabetic patients with rigid red blood cells. Next, we'll talk about vitamin K2, which prevents arterial calcification. By activating a protein called matrix-GLA protein, K2 helps remove calcium deposits from vessel walls, improving arterial flexibility and blood flow. Deficiencies are common in Western diets, especially in older adults, and supplementation has been shown to reduce arterial stiffness and improve walking distance in multiple studies. Vitamin C is next. Essential for collagen synthesis, it strengthens blood vessel walls and supports wound healing. It also works synergistically with vitamin E to protect cells from oxidative stress and preserves nitric oxide for better circulation. In seniors with PAD or chronic leg ulcers, correcting vitamin C deficiency accelerates healing by 40 to 60%. We'll also cover niacin or vitamin B3, the single most powerful vitamin for increasing leg blood flow. In clinical trials, niacin raised blood flow 35 to 40% within 2 weeks and prevented up to 60% of amputations in patients with critical limb ischemia. It provides direct vasodilation, improves lipid profiles, and lowers cardiovascular risk factors like lipoprotein A. Vitamin D, the second most important vitamin, supports endothelial function and reduces inflammation. Deficiency is extremely common in adults over 60 and significantly worsens circulation. Supplementation improves nitric oxide production, walking distance, and inflammatory markers. Finally, vitamin B12, critical for nerve function and red blood cell production, helps prevent neuropathy, improves oxygen delivery, and corrects anemia. Supplementing B12 in deficient seniors improves numbness, tingling, and overall leg health within weeks. Testing for specific deficiencies and targeting supplementation produces the most dramatic improvements. These vitamins are widely available, safe, and effective when used correctly. In Part 2, we'll dive into dosing, forms, and monitoring, so you can safely take action and dramatically improve your circulation, walking distance, and quality of life. Welcome back! I'm Dr. Sarah Collins, and if you watched Part 1, you already know that poor leg circulation isn't just a nuisance. It's a serious health risk for anyone over 40, 50, or 60. In Part 1, we covered the first 3 vitamins that protect blood vessels, enhance blood flow, and help prevent serious complications like non-healing ulcers and amputations. Now, in Part 2, we'll dive deeper into vitamin D and vitamin B12, plus show you how to use all these vitamins effectively to see real improvements in leg circulation. Let's start with vitamin D, the second most important vitamin for older adults with circulation problems. Vitamin D is not just for bones. It's a powerful regulator of your vascular system. It controls endothelial function, the health of the smooth muscle cells in blood vessels, and reduces inflammation. Deficiency in adults over 60 is extremely common, affecting nearly half of seniors, and can dramatically worsen circulation. Without enough vitamin D, your blood vessels can't relax properly, inflammation rises, and plaque buildup accelerates. Studies show that correcting vitamin D deficiency improves blood flow, reduces inflammatory markers by 30 to 40%, and even increases walking distance in patients with peripheral artery disease. Optimal blood levels are between 40 and 60 nanograms per milliliter. If your levels are low, supplementing with 2,000 to 4,000 IU of vitamin D3 daily and rechecking after 3 months can restore proper vascular function. Taking vitamin D with meals containing some fat helps your body absorb it better. Maintaining healthy vitamin D levels supports all the other vitamins we discussed and creates a strong foundation for healthy circulation. Now let's talk about vitamin B12, one of the most overlooked vitamins in older adults. B12 is essential for nerve health and red blood cell production. Without enough B12, your nerves can become damaged, causing numbness, tingling, and pain in the legs, symptoms often mistaken for circulation problems. B12 deficiency also leads to megaloblastic anemia, where red blood cells are large and inefficient at carrying oxygen, worsening tissue hypoxia in your legs. Correcting a B12 deficiency can dramatically improve neuropathy symptoms and oxygen delivery to leg tissues. Clinical studies show that supplementing B12 in deficient seniors improves numbness and tingling by 40 to 60% within just 8 to 12 weeks, while normalizing red blood cell function. If your levels are low, you can supplement with 1,000 to 2,000 micrograms of methylcobalamin daily, either orally or via injections if absorption is an issue. Rechecking your B12 levels ensures you're restoring nerve function safely and effectively. So far, we've discussed 6 vitamins that work together to restore leg circulation. Vitamin E for protecting the endothelium and red blood cells, vitamin K2 for preventing arterial calcification, vitamin C for collagen synthesis and antioxidant support, niacin for powerful vasodilation and improved lipid profiles, vitamin D for reducing inflammation and supporting endothelial health, and B12 for nerve and red blood cell function. Each vitamin works through a distinct mechanism, so targeting deficiencies rather than taking random combinations is the fastest path to improvement. Now, let's talk about practical steps you can take to use these vitamins safely and effectively. First, get tested. Simple blood tests can identify deficiencies in vitamin D, B12, vitamin C, and other key nutrients. For vitamin K2, functional tests measuring undercarboxylated matrix GLA protein give the best insight into whether you need supplementation. Once you know your deficiencies, use high-quality supplements in the correct form and dose. For example, niacin should be nicotinic acid, not nicotinamide, to provide real circulation benefits. Vitamin K2 works best as MK7, which has better absorption and longer-lasting effects than MK4. Second, start slowly and monitor your body's response. Some vitamins, like niacin, can cause side effects such as flushing, which is normal and temporary. You can minimize flushing by starting with low doses, taking it with meals, or using extended-release formulations. Regularly monitor your lab values, especially if you are taking medications like blood thinners. Vitamin K2 can interact with warfarin, so always coordinate with your doctor if you are on anticoagulants. Vitamin D, vitamin C, and B12 are generally safe with minimal risk, but monitoring ensures you're achieving optimal levels for circulation. Third, combine supplementation with lifestyle strategies that naturally improve circulation. Gentle walking, leg elevation, compression stockings if recommended, and avoiding prolonged sitting can all enhance the benefits of targeted vitamins. Maintaining a balanced diet rich in fruits, vegetables, lean protein, and healthy fats supports absorption and overall vascular health. Hydration is also critical. Water helps blood flow more efficiently through your veins and arteries. Many of my patients are amazed at how quickly these interventions work. Within weeks, ulcers start to heal, legs feel warmer, tingling decreases, walking distance increases, and the risk of severe complications drops dramatically. Targeted supplementation gives your body the tools it needs to repair blood vessels, reduce inflammation, and restore oxygen delivery to your tissues. The combination of vitamin testing, correct supplementation, and lifestyle adjustments produces results that medications alone rarely achieve. Before we wrap up part 2, I want you to remember one thing. Poor circulation in older adults is not inevitable. You don't have to accept numbness, cramps, slow healing wounds, or reduced mobility as part of getting older. These symptoms are warning signs of underlying deficiencies that can be corrected. By understanding and addressing these key vitamins, E, K2, C, niacin, D, and B12, you can dramatically improve circulation, prevent serious complications, and reclaim your quality of life. In part 3, we'll dive into specific dosing schedules, combinations that work best, and how to monitor your response over time, so you can take concrete action to protect your legs, avoid amputation, and restore mobility safely and effectively. Welcome back! I'm Dr. Sarah Collins, and in part 3, we're going to bring everything together. We've already discussed the 6 key vitamins that improve leg circulation: vitamin E, K2, C, niacin, D, and B12, and why they're critical for adults over 40, 50, and 60. Now it's time to focus on how to use them correctly, the best combinations, and simple strategies to get real results fast. This is the part where the information turns into action. First, let's talk about dosing schedules and timing. Vitamins are not all created equal, and taking them randomly won't give you the benefits you need. For vitamin E, aim for a biologically active form, such as alpha-tocopherol, with doses typically around 200 to 400 IU daily. Take it with meals containing fat for maximum absorption. Vitamin K2, especially MK7, is best taken 180 to 360 micrograms daily with a meal, ideally breakfast or lunch to spread out absorption. Vitamin C, being water-soluble, should be taken in divided doses of 500 to 1,000 milligrams daily, morning and afternoon, to maintain steady blood levels and support collagen synthesis for vessel walls. Niacin, the powerhouse vitamin for circulation, must be in the correct form. Nicotinic acid, not nicotinamide. Start with 500 milligrams at bedtime, then increase gradually by 500 milligrams every 2 to 4 weeks to reach 1,500 to 2,000 milligrams daily, depending on tolerance. Extended-release formulations help reduce flushing, and taking a small aspirin 30 minutes before can also minimize this effect. Vitamin D3 should be taken daily at 2,000 to 4,000 IU, with a meal containing fat, and vitamin B12, ideally methylcobalamin, at 1,000 to 2,000 micrograms daily, or via injection if absorption is a concern. Second, it's essential to monitor your response and adjust as needed. Blood tests are your roadmap. Check vitamin D and B12 levels every 3 months until they are optimized. For vitamin K2, functional tests measuring undercarboxylated matrix GLA protein indicate whether your supplementation is working. Vitamin C levels can be checked through plasma ascorbate, and niacin benefits can be measured by improved ankle brachial index, walking distance, and reduced pain. By tracking these markers, you'll know you're correcting deficiencies rather than guessing. Third, synergy is key. These vitamins work best when used together in the right combinations. Vitamin E and C support each other as antioxidants, protecting blood vessels from oxidative stress. Niacin improves blood flow directly and enhances HDL cholesterol, which slows plaque buildup, while vitamin K2 prevents calcium deposits that stiffen arteries. Vitamin D reduces inflammation and supports endothelial function, creating a better environment for all the other vitamins to work. B12 ensures nerves and red blood cells function correctly so that oxygen actually reaches your leg tissues. When taken together with the correct dosing, these 6 vitamins create a comprehensive, powerful circulation support system. Lifestyle strategies further enhance results. Gentle daily walking stimulates circulation, strengthens muscles, and improves endothelial health. Leg elevation after periods of sitting reduces venous pooling and swelling, while compression stockings can support veins in patients with chronic venous insufficiency. Avoid sitting for long stretches and make hydration a priority. Adequate water intake improves blood viscosity, making it easier for your blood to flow efficiently. Nutrition matters too. A diet rich in fruits, vegetables, lean proteins, and healthy fats ensures you're getting the nutrients your body needs to absorb and utilize these vitamins effectively. Now let's address a crucial point. Many seniors assume poor leg circulation is just part of aging. It's not. Persistent cold feet, cramps, tingling, slow-healing wounds, or decreased walking ability are warning signs of underlying deficiencies and vascular issues. By identifying and correcting these deficiencies, you can dramatically improve mobility, reduce pain, and prevent devastating complications like ulcers, infections, or amputations. The data is clear. In patients with critical limb ischemia, niacin alone reduces amputation rates by 60%, while targeted supplementation with all 6 vitamins accelerates wound healing, improves blood flow, and restores independence. Let's summarize the action plan. Step 1. Get tested. Identify deficiencies in vitamin D, B12, vitamin C, and functional markers for vitamin K2. Step 2. Supplement strategically, using the correct form and dose for each vitamin, gradually adjusting as tolerated. Step 3. Monitor progress through lab tests, walking ability, pain levels, and vascular assessments. Step 4. Integrate lifestyle practices, including walking, leg elevation, proper nutrition, hydration, and compression support if recommended. Step 5. Stay consistent. Vitamin therapy works best over weeks and months, and continued adherence protects your legs, improves circulation, and reduces serious risks. Finally, remember that age is not a barrier to better circulation. Whether you're 45, 55, or 70, taking these steps now can prevent pain, preserve mobility, and dramatically reduce the risk of serious complications like blood clots, ulcers, and amputation. These 6 vitamins are accessible, safe, and effective when used correctly. The power is in knowing your deficiencies, targeting them, and supporting your body holistically. So I want you to ask yourself, do you want to continue feeling numbness, pain, and fatigue in your legs? Or do you want to take control today? Start with testing, take the right supplements, and follow the strategies we've outlined. Your legs, your mobility, and your independence are worth it. Thank you for watching this 3-part series. If this information helps you or someone you love improve circulation and avoid complications, share it. Subscribe to our channel for more vascular health guidance for seniors, and comment below which vitamin you think might make the biggest difference in your life. Stay consistent, stay proactive, and take control of your health, because you deserve strong, healthy legs for years to come.